Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Dr. Maria Ryan, Chief Clinical Officer, Colgate-Palmolive. Maria, welcome. Thank you for joining us.
Thank you for having me on your show, Chitra.
Maria, Colgate-Palmolive, $18 billion global consumer goods company with products in 200 countries. 4 divisions: home care, personal care, pet, and oral. Oral care is half of Colgate's entire business. Share with us the key areas fueling growth, especially in the oral business.
Yeah, well, health is at the core of what we stand for as a company. And if you think about our corporate purpose as a caring and innovative growth company, we're really reimagining a healthier future for all people, their pets, and our planet. We are very lucky in the oral care space to be the leader in the consumer world, but we also have a professional business. Um, and the focus for us has always been the main diseases that we face in oral health, prevention of caries. Um, Gum disease is a very important initiative that we're continuing to grow on. We've always been there, but we're continuing to grow in that space because it's a growing problem worldwide. We have a very robust whitening business and really have worked to democratize whitening for people throughout the world. I think we have the best desensitizing agent on the market. So sensitivity is important for us as well as erosion. And, our focus has always been on prevention, but we have many therapeutics and ways for people to improve on their oral health care and to help professionals to do a better job as well.
You're in a commoditized business, price times volume. Colgate stock down roughly 9% over the last year. Increased competition, especially from Procter & Gamble, GSK. Your CEO recently said the macroeconomic outlook is volatile, which impacts consumer spending. And the company has faced extraordinary costs, headwinds in raw materials and foreign exchange. How do you differentiate in a commoditized business and squeeze to growth, especially in oral care?
Yeah, we have a very, very, very strong R&D arm in the company, and this really supports our innovation. We have incredible presence in doing clinicals throughout the world. We do over 200 clinicals a year, and for not only our oral care, but our personal care, skin health, and our veterinary businesses. As I mentioned, whitening is a very strong area. We were the first to get the ADA seal for a toothpaste to allow for intrinsic whitening. We've used device and chemistry to improve on the chemistry for whitening. So with our trays and other devices to help with whitening, we have made significant strides. We continue to grow our whitening business, not only over the counter, but also in the professional business. And in that business, we have partners like 3Shape with 3D imaging, where we've been able to create the first precision whitening app. So you could actually tell somebody how their own teeth are going to look when you utilize this product based on our clinical work, which is very, very special. We've also focused on the microbiome, and that's a very important area for oral care, how to create a healthier microbiome, utilizing actives like arginine, which is a natural. And we have a new special issue actually coming out in a couple of months from the Journal of the American Dental Association, which will talk about the years of work we've put into our microbiome initiative for oral care. But we have the same initiatives in our skin health business and our veterinary business. And then finally, our connected technology business, really enabling behavioral changes, which are necessary for optimal oral health care, and enabling people to participate in their care by getting information back from their toothbrushes. So it's an exciting time for us.
How do you deliver innovation at scale for a part of the body that's so individual for both the patient and the doctor? For the patient, the mouth is individual because of the flora, the bacteria and fungus that's living in each person's mouth, and that impacts our ongoing health and healing process. And for the doctor, outside of the routine cavity and cleaning, the dentist process is individualized. And for the specialists, whether it's the orthodontist, prosthodontist, endodontist, periodontist, oral surgeon, even more so.
Yeah, the four P's of precision health, which were first described by a guy named Lee Hood, who's really moved precision medicine forward over the years. We're applying this for precision oral health. And the first P, we're the world's leader in being preventive. And those strategies can be based on risk, and where we could provide superior products with superior performance in certain areas of need. And then we have regimens. So we have everything that you need in the oral care category, including our actives in our tooth pastes. We have our toothbrushes, whether they be manual or powered or connected. And we have a very robust mouthwash business that continues to grow based on innovations in our mouthwash technology, particularly in Latin America. Growth is very significant there. And we have floss and interdental cleaning. And then, in order to have a personalized care, you have to be predictive. And so we have programs looking at the development of more screening agents, so that we can screening tools, diagnostic tools that will enable us to pick out those high risk individuals and push them in a certain direction. And then when we say personalized, it doesn't have to be for each individual person, but it could be a population that's at higher risk, like people with diabetes or smokers. So we can develop products to address their specific needs. And then, of course, the participatory part, as I mentioned before, with our connected technologies and programs like Know Your OQ or Know Your Oral Health Quotient, which educates people about the importance of oral health to their overall health and well-being.
Since you're talking about the importance of oral health and different populations that you serve, how do you reach and convert consumers in these varying geographies, cultures, contexts? There are places in the world where people don't use or can't afford to use toothbrush and toothpaste. I was born in a country in South America where to this day, some still use tree bark to clean their teeth. So how do you reach and convert consumers?
Yeah, we have our consumer insights teams, our tech insights teams. We have partners all over the world, whether in academia. And then we have programs like Bright Smiles, Bright Futures that teach people very early on about the tools that they need to achieve improved oral health. And that works with the schools early on for education, with the parents, with government agencies to really get the message out and really understand the local needs in various communities. And we have dental health units located in different parts of the world, in Latin America, in India, in Europe. And of course, our global technology centers, we have them throughout the world. We have 8 of them throughout the world. So we really are boots on the ground there and many partners to ensure that we're addressing the needs of people in various geographies throughout the world.
You talked about precision medicine, personalization, analytics. There are many digital health startups that believe that they've got great ideas and solutions that could be additive to Colgate. Where are you partnering with startups and what are some of the focus areas?
Yeah, we have an innovation portal where people, startups can put in. We work also with various organizations like Plug and Play and others to get involved with startups. On the digital space, we have a lot of interest there. As you know, telehealth, teledentistry, especially since COVID has really expanded dramatically. And with a partner, Barracoda, in the digital space, we've developed our connected technologies which is really important to those behavior changes and really helping people to do a better job on brushing. And we have other digital partners like 3Shape, which I mentioned before, which can help with precision oral care. And I was really happy early on when we got into this area to partner with Apple. And at that time, if you looked at the Apple Health app, there was nothing in there about oral care. And when we first came out with our connected technologies, we worked through Apple's research kit to get enough information to enable them to allow us to put oral health into the Apple Health app, which is really bringing the importance of oral health forward throughout the world. And we have other partners like Verily, where we're using our digital technologies to improve on care in populations that they've been following who have diabetes and or cardiovascular disease. And so we're in the midst of a long-term study where we're looking at the impact of oral care on improving on the health of people with cardiovascular disease and diabetes. So I think the digital part is very important to us, but there are many other areas we're looking at as well.
You're a significant actor. Colgate is a significant actor in the healthcare ecosystem. How are you advocating for patients to get more accessible and affordable oral health care? Many insurance providers only offer $1,000 to $2,000 per year in coverage, which is no way enough. How are you advocating for the patient, for the consumer?
Yeah, well, we participate in many organizations that are also advocating for consumers, like the Santa Fe Group, which worked to get oral care included in some of the Medicare services. We also, in Europe, participate with the Platform for Better Oral Health in Europe, which is responding to the World Health Organization's initiatives to improve on oral health, as they've identified that 3.5 billion people suffer from oral disease throughout the world. Colgate has had a program called Bright Smiles, Bright Futures for many years, reaching out to underserved communities, providing information in over 30 languages to help parents and teachers and kids to learn more about the importance of oral health early on in their lives. And so I think Bright Smiles, Bright Futures, which has reached 1.4 billion children worldwide, is a very important program that Colgate has. And for many of these children, it may be the first toothbrush that they've ever had, the first time they've ever used toothpaste. So it's a very important program. We also partner with the American Dental Association on their what they call Give Kids a Smile Day, where we partner with dentists who provide care for children who may not have access to care otherwise. We're also partners with the National Dental Association, the Hispanic Dental Association, the Society for American Indian Dentists, where we have scholarships and other programs to increase the numbers of dentists from those communities, because we recognize the importance of patient-dentist concordance to many people. They want to go to someone who looks like them, who's has similar background, and the numbers are very low. So Colgate has tried to increase those numbers as well, which I think is very, very important. And then finally, our Know Your OQ program, which I mentioned before, which really is a public service program, reaching out to people, explaining to them what the signs and symptoms of oral diseases are, what the impact of not managing them or preventing oral disease can be, not only on your oral health, but your overall health and well-being, increasing your risk for stroke and heart attacks, increasing risk for developing diabetes, for adverse pregnancy outcomes, or even for developing respiratory diseases, is all within that. So once people understand the importance of oral health, and then the preventive strategies that they can take, which is also found within that website and app, then they can take action, and they can find care, whether it's with a federally qualified health center, at a dental school. Most dental schools throughout the United States serve Medicaid patients, or with private practitioners, or at a dental service organization. So all of that information is provided. So we try to help people to get to the care that they need.
Maria, thank you so much for joining us.
Thank you for having us, Chitra.